During Hispanic Heritage Month, we are highlighting the stigma of mental health in the Hispanic and Latino communities. Joining us now to talk a little bit about that stigma is mental health expert, Dr. Cheryl Ziegler. So first of all, let's kind of break down the idea of this. This, is something I guess most of us know. There are certain groups. I think sometimes you even say genders. Men might be a little more reluctant to seek mental health than women, but what is it with the Hispanic and Latino communities?
So first, when we say Hispanic and Latino, that really means a lot of different things. We have different mental health stats depending on whether you're Cuban, which is a lower percentage, maybe 10% have a diagnosable mental health condition, all the way up to Puerto Ricans, which say they're about 28%. So I just want to be clear that, there's all these different kind of subgroups within what we say is Hispanic. But one of the biggest things is the stigma in that community is really strong. So people basically feel like they say, I don't want to be called loco. I don't want to be called crazy. And that's just the way they think about it. And so what they do is they take their mental health issues and they report physical health issues. So they'll say, I have fatigue, I have back pain, I have headaches. And so one of the big things to take away is that who most people, not just Hispanic communities, go to, they go to their general practitioner. They go to their regular doctor, and then they're going to come to them with these presenting physical issues. And so one of the big takeaways is to know if you're being really culturally competent, you're thinking, well, could there be a mental component to this? And that's really important to ask about.
Is it a tricky discussion? Because it borders, in some ways, you think, on a form of racism when you're defining people by their culture instead of by their individual. But it's also, like you talk about, the studies say it's the truth.
Yes.
It's the way it is.
I love that question. I think when you say somebody is culturally competent, what that means is that I just know enough about this particular culture to ask you the questions. So that doesn't mean I'm going to make assumptions, and that doesn't mean I'm going to treat you, in this pigeonhole of something. I know enough to ask. And so it's like you could ask questions like just simply, is there a history of, let's do a whole history of your family's health, and then go through mental health and physical health kind of things and try to get through that. So all it says is that you are aware enough to know to ask the questions.
And then treat the individual individually.
Absolutely.
So in some respects, it kind of makes me think of like the postpartum discussion, is that the doctor really has to be keenly aware to ask questions, and maybe people around you need to be keenly aware to kind of go, maybe you should talk to someone.
Well, yeah, and when we're looking at this issue and we're saying, what can we do? That's the first thing, is have physicians be, trained in cultural competencies. That's really important. The next thing is the language barrier. So that can be just in and of itself a huge problem. And so if you don't have somebody who's bilingual in your practice, get an interpreter. Even have maybe a day, a whole morning, a half a week, whatever it is that interpreter's there to try to help translate this and really make sure you're getting at this. And also involve family. In Hispanic cultures, generally speaking, everything's a family affair, whether that means your immediate family or even extended family. And that's something that would be different. You might not think to do that with all cultures, but when it comes to Hispanic ones, you could just ask the question, would it be helpful if, one of your children or your spouse or your mother came into the next appointment to really help me understand what's going on here? Just simply asking that could really be a game changer.
I think of two great hurdles. One is to getting anyone to see a doctor, much less somebody to go see and seek mental health help. The second is, once you get there, to open that door, as you've described, to get that relationship so that the patient can understand the doctor can understand the patient, and vice versa, and develop the trust that it takes to really investigate mental health.
Absolutely, and that's why I'm so focused on the general practitioner, because people don't immediately go to a psychologist. They say within a Hispanic culture, it can be as low as 10% of people with diagnosable mental health conditions even go seek any treatment. Any at all. So it's really, really low. So there's a huge barrier there. So anything that you can do to just sort of educate who they're going to go to first, they're not going to go to a psychologist first. That would be extremely rare. They're going to go to their trusted doctor or just a doctor in a clinic. And so again, the emphasis is on how do we get those general practitioners and physicians to just be aware enough to ask the questions.
And hopefully point out the correct direction for treatment, for getting some help. Dr. Cheryl Ziegler, it's always good to see you. Thanks for joining us.
Thank you.